Welcome to another edition of Dan Frequently Asked Questions. In this edition, we'll be discussing inguinal hernia repair and return to diving. Keep watching. Inguinal hernias are actually a relatively common condition that develop typically later in life and usually affect males. They're sometimes associated with increased volume of the prostate, resulting in needing to press harder when voiding the bladder, and this may result in ultimately developing an inguinal hernia. There is another form of inguinal hernia that happens in young people, but this is unlikely to be the situation as described by the particular diver in question. So the question then was, they had undergone a surgical procedure in which a mesh had been placed. Now, in previous years, there was an open surgery to the area, and sutures were applied to close the opening of the hernia. Nowadays, a mesh is inserted to provide extra fortressing of the area and thereby limiting the chances of the hernia recurring. The standard recommendations apply, and that is that the healing process usually takes 6 weeks. And so our general recommendation with any surgical procedure is to wait at least 6 weeks. And in this case, what you'd also want is clearance from your surgeon, general surgeon who did the procedure, and if necessary, a diving physician. The bottom line is that you should have no further pain in the groin, and that there should, of course, be no further herniation. In other words, the intestines should not push through the area where the surgery was done. And if there's no pain, everything works, and the surgeon says you're good to go, you typically would be, as long as there's no impairment on your ability to exercise. Thank you for the question, and until next time, safe diving.